this is the need of the hour right now in this season of viral fevers and cold and cough. Many parents might be in distress thinking about their children's problems, how to help my child deal with fever, cough, cold at home. And I'll be more than glad to give you a few uh, remedies, home remedies, or things to do at home, or first aid measures that need to be followed in case of fever, cold, or cough. So, first things first, self-medicating children with improper dosages or over-the-counter medications is very harmful. I would please request all parents to refrain from that. And in case of fever, the first and foremost important thing is appropriate control of temperature. So temperature in the sense we need to check the temperature with a digital thermometer and not with the help of a hand or any other source. Like you cannot touch a child's forehead and decide that he needs fever medication. It's always advisable to check the child's temperature, and based on the temperature readings, the parent needs to give appropriate dosages of paracetamol to control fever. And they can get these dosages from the doctor or from the pediatrician easily. And it's always wise to keep a bottle of paracetamol at home available, and also to know the appropriate dosage beforehand. So the first thing is giving appropriate dosage of paracetamol around the clock. Along with this, the second most important thing is good hydration, good liquid intake. When there is fever, children tend to get a lot dehydrated. So it's very important to keep up their fluid intake. How can they do this at home? They can use ORS, that is oral rehydration solution, which is WHO recommended formula. They can get, if the child is on breastfeeding, it's very, very, very good to continue breastfeeding. If not, they can give fresh fruits, something like soups, or coconut water or buttermilk to maintain their hydration. Maintaining hydration is as important as controlling the temperature when the child is running a fever. And I wouldn't suggest giving beverages like glucose, glucon D, or sugar water, because they are not going to rehydrate the child. Instead, they're going to pose more problems. And third thing is knowing the first aid for seizures fits, because some children have this tendency to throw fits when they're running the fever, because their threshold to control seizures decreases when they're running a fever. So it's important for the parent to know what to do when that happens, how to react, when to rush to the hospital. Instead of panicking, if they know these beforehand, it's going to help.